Hey everyone, happy Friday. Um, just move this here so you can actually see me. So today I'm going to be talking about PCOS and heart health. February is Heart Health Month, and so um, there is one, most important thing I would say to do when it comes to heart health and PCOS. So we will get to that, but before I get to that, I want to talk a little bit about most important lab work that you can consider. I'm just closing a few things down here to get my internet connection. Good. Okay. So, most important lab tests to do when it comes to PCOS and heart health. The first test is a lipid panel, so your cholesterol. The cholesterol panel is so important because it gives us three things that I usually typically look at. So, triglycerides, these are a type of fat that accumulate in the liver, and we get fatty liver when the triglycerides are high. And the way that we actually see the triglycerides going high is because of insulin resistance. If insulin can't bring glucose inside the cell, inside the muscle cell specifically, it's going to shuttle the glucose into the form of fat in the liver. And this is really important to really know because oftentimes fatty liver disease is associated with too much alcohol consumption. But in fact, when we eat too many carbohydrates and we have insulin resistance, it can actually impact our triglycerides in the liver. So really important to be checking cholesterol panel, looking at triglycerides. Second thing is HDL. This is our good cholesterol. We want lots of good cholesterol. And the way we get that is through fatty acids, so omega-3 fish oils, and good healthy fats in our diet. Lots of good nuts and seeds, I would say, except for peanuts. So almonds, pistachios, walnuts, pecans, any of those, cashews, any of those really good healthy fats, and then also avocados. Healthy oils that I really like are avocado oil. That one's a good one actually that you can cook on higher temperature. Coconut oil as well on higher temperature. Olive oil, and then even grapeseed oil is actually really neutral oil. Doesn't taste like very anything, and I believe you can cook it on high temperature too. So that's HDL, good cholesterol. Bad cholesterol is LDL. So typically, when we do the lipid panel, it'll actually tell us our cardiovascular risk disease over the 10-year period based on the numbers. So this is really important test to be doing, checking LDL, which is our bad cholesterol. Typically, we don't want this number passing 3 in Canadian units. I'd have to check the exact units because I'm forgetting off the top of my head, but check those numbers. It will tell you where you land on the lipid panel in terms of your risk for cardiovascular disease. So really important. Usually LDL comes from sometimes genetic. So oftentimes we do see LDL as high because there's a family history of genetic high cholesterol, but also, eating lots of processed meat, cheese, baked goods, what else? Foods that are like fried. So really important to be kind of looking at the LDL in the lipid panel, seeing where you land, and then also what you can do in terms of bringing that level down in terms of diet. Sometimes I've also found that stress can also impact the cholesterol panel, so because of the inflammation we get from stress. So really important to consider that as well. Okay, so lipid panel is number one. The second one is HbA1c. This is how well we process glucose over the last 3 months. So in terms of looking at this marker, we're looking to see our risk for diabetes. So depending on where you sit on the percentage, they'll give you a number that will say at risk, pre-diabetic, diabetic, and beyond. And so it's really important to be checking HbA1c, especially for insulin resistance and glucose management, but also for cardiovascular risk disease, because we do know diabetes is, one of the risk factors for heart disease and cardiovascular disease, especially in women with PCOS. So really important to check HbA1c. And then last but not least is HSCRP. This is high sensitivity C-reactive protein. And this marker actually tells us about global inflammation in the body. And we know that if there's inflammation, even in the arteries, that can impact our heart health. And typically, I do see HSCRP high when the patient does have insulin resistance, or like mostly like moderate to severe insulin resistance. So HSCRP, HbA1c, and then the lipid panel. But the number one thing you really want to do when it comes to heart health and supporting your heart on a daily basis is getting your body moving. So I always get the question, what's the best exercise for PCOS? And then I usually say, well, what do you like to do? What is your favorite exercise? Because honestly, it doesn't really matter which exercise you do as long as you get your body moving. We obviously have research to say like what is the, most appropriate exercise for PCOS, and we can go over that. But before we even get there, let's forget about the science and really focus in on something that you really enjoy to do, enjoy doing, because that will make you be more consistent with getting your body moving. Whether that's walking, yoga, Pilates, weight training, whatever makes you feel good and gets your heart rate up and your body moving and your body sweating is kind of where you want to be. You don't want to overdo it though, because if it's too much exercise or the intensity is too high and you're feeling tired and drained after the workout, then this can, impact our adrenal glands. So really just see how you feel as you work out and adjust as needed. So when we see, like when we look at the research, high intensity interval training really good for metabolic health and also for insulin resistance. But if the intensity is too high, a lot of patients find that they're feeling more drained after doing this workout, especially in the women that I see. So bringing that intensity down, maybe medium interval training, lower weights, slower movements are best. One thing that I've seen in the research that I find really, really interesting is working out leg muscles. Leg muscles are where it's at. So our glutes and our quadriceps, and so basically our thighs and our glutes. In what you can do with this is honestly resistance bands can be really, really effective at getting these muscles activated and moving. And even just like squats and lunges, walking up and down the stairs. We know stairs can actually really, really help with, supporting these muscle groups and getting them moving. And the mechanism behind this is that the more the muscle moves and pumps blood flow to the muscle, the more the glucose is actually going to get inside the cell where we need it to be inside the muscles, instead of the insulin pushing that glucose into liver cells or even into fat cells in our abdomen, where we usually see insulin resistance, signs and symptoms of insulin resistance. So resistance bands, medium interval training. I usually just like to go on Pinterest and look at resistance band exercises and just do, a few of those exercises. They can really stimulate the muscle groups. And right now here in Toronto, it's winter. And I know a lot of you can't go outside because of the snow. Hopefully you're in a sunny country or state and you can go outside and get your body moving. But here it's a little bit more difficult, especially because I think it's -10 today and it's going to feel like -17. So really important to, get some things at home that can really help you. So if you have stairs, great. Resistance bands are really cheap, even just 5-pound weights, and using those. Even if it's just like a 15-20 minute workout, can really help the body overall. So I hope that was helpful for you guys and gave you some ideas on what you can do for heart health. Next week, Tuesday, at 7 p.m. Eastern Standard Time, I'm forgetting what actual day it is, February 8th, I'm going to be on a panel with PCOS Challenge, and we're going to be talking about heart health and metabolic risks. So please join us there. If you go on Instagram and just search PCOS Challenge, you'll be forwarded to all the events that are coming up next week for PCOS heart health. So please stay tuned and take a look at that. Really, really important to work on heart health now. depending on whatever age you are, but even, in the ages of 25 to 30 to beyond, really important to be focusing on our heart health and insulin resistance when it comes to PCOS. So happy Friday, everyone, and I'll see you next week.